is a definition that I particularly like, because this talks about commissioning in terms of conscience, brain, eyes and ears. And again, the concepts that go with that are readily recognisable. So the conscience, it's about stewardship, it's about quality assurance, it's about public protection. Those are the responsibility of commissioners, and you can describe those as the conscience of what we need to do. The brain is about resource allocation, service design and planning, and the eyes and ears are listening to the people that we serve. Commissioners are there to understand what it is that people need and then to source those services. And increasingly from the 1970s, the source of public services can be anybody. It can be Bupa, it can be Virgin Health, it can be Capita, it can be G4S. To use an NHS phrase, it's any qualified and willing provider. We normally talk about commissioning in a cycle. And these are the 4 strategic phases of that cycle. It's about evaluating what people need. It's about designing the way those systems will deliver what people need. It's sourcing it. It's finding the people to deliver them, whether it's within the public service or in the private sector. And then the final section of that is about reviewing to make sure what it is you've just sourced is actually meeting the needs that you identified. But why does all that matter? So why have we spent 30 years developing commissioning? Why is it really important that that commissioning cycle is delivered effectively? What is it that really matters about commissioning? It's because commissioners are the local NHS, or social care, or local authority. Because they are the end of the public sector now. They are the last people who dispense public money derived from taxes for the benefit of the public. People beyond that now, in terms of private sector, will take money in as part of a contract to make a profit to give to their shareholders. So let's look at some of the expectations that are placed on commissioners and try and make a decision about whether they're actually realistic or not. So what's required of commissioners as we stand here today? So they've got to deliver unprecedented savings, whether that's in the NHS, whether that's in local government, the police, any public service. The level of savings expected of all public services has never been at this level before. In the case of the NHS, they have to implement the biggest changes since 1948. Sir David Nicholson, the Chief Executive of the NHS, described the last set of reforms that became effective from April this year as so big you could see them from space. Well, they certainly were big as far as the NHS is concerned. So it's always about money, isn't it? It's always been about money because these are taxpayer resources that we're spending, taxpayers' pounds that we're committing, and therefore we have to be seen to be the most effective people at using those resources. The financial resource question in the NHS is known as the Nicholson Challenge. And the first line of this says a £20 billion national target of cost reduction. And people say to me, well, how is that? I've heard Mr Cameron say, I've heard George Osborne and all our Secretaries of State for Health say, actually the NHS is ring-fenced. So if the NHS is ring-fenced, why is it you're having to make £20 billion worth of cuts or savings in the service? The answer lies in the third line. The reason that the NHS needs to save £20 billion is that all independent commentators recognise that the changing demographics of our population, the ageing population, the cost of drugs and new treatment, means that the NHS needs at least 2% a year just to stand still.